right, guys, welcome everybody. What I'd like to do today is I'm just going to put up a couple slides to give us some background information, and then we're just going to kind of open it up to have a discussion if that's okay. So, our topic today is cancer or chemotherapy-induced peripheral neuropathy. And if I can figure out how to turn the slide, there we go. Once again, this is not a medical interaction. I'm not giving you treatment or advice. We're just talking about education here. Anything you have questions on that might require a doctor-patient relationship, we'll try to help you get set up with somebody. Okay, so chemotherapy-induced peripheral neuropathy. It can be described as numbness, tingling, or a burning sensation. It's commonly in the hands, the fingers, the toes, the legs sometimes. There is a chemotherapy that some colorectal cancer patients get that describe it as a cold sensation in the face or the jaw. It can lead to symptoms of just feeling weakness in the legs or clumsiness in the hands, like you feel like you can't button a shirt. Sometimes the pain can be exacerbated at nighttime, maybe with the covers touching the feet. It can often make it difficult to walk or stand for prolonged periods of time. I've had some patients complain that they just kind of feel loss of balance. And then there's a weird, very kind of rare type that's really is more of an autonomic dysfunction, which can lead to some GI or some bladder symptoms. But those are the most common symptoms. And the causes of this are the chemotherapy drugs. Usually it's the platinum-based agents, the cisplatin or the carboplatin. The taxanes can also cause it. Those are commonly used in breast cancer. And there's some of the vincristines and vinblastines that are used typically, probably more in the pediatric cancer space. And if a person has a history of diabetes, they seem to be, in my experience, more pronounced when they have the neuropathy, and sometimes it's harder to treat because neuropathy is often a side effect of diabetes also. So I like to think of coming from an integrative background. I always want to look at, what can we do to treat this that doesn't involve another medication? I'm a huge proponent of exercise, which may sound counterintuitive. You just told me about pain, numbness, tingling, and balance issues. But there's so much information out there that if we keep somebody exercising, somebody building muscle mass, somebody doing balance exercises that might include Tai Chi or even yoga can really help reduce these symptoms and help with that balance and those gait problems. I'm a huge fan of acupuncture. If I can get a patient started in acupuncture when they start chemotherapy, I think it's even more valuable. I have had patients who come in after treatment with the neuropathy, and I think the acupuncture can help, but I think it's one of those things where sooner is better. There is a few cases or people using this cryotherapy. You may have heard of this for the caps that people can wear on their head to try to decrease hair loss. There's some evidence that it may help to use the hands and the feet in these cold frozen gloves to may decrease the neuropathy also. And then also, once again, I love the physical therapy, occupational therapy, who are great with helping with gait training, balance exercises, and just really any physical impairment. So those are our non-pharmacological approaches. Treatment, you may have your oncologist provide gabapentin, Lyrica, are the two most common. Sometimes Cymbalta are medications that can often be used to help this. But I always say caution patients, if you get put on these medications and it doesn't help, then look at stopping it. Because so many times we'll put someone on a medication, it doesn't really help, and we never stop the medication. Once again, I like physical therapy and occupational therapy. And then there's a few supplements that can be used, but I always want to go check the lab work first to see if these are truly indicated. So if I have a patient that presents with neuropathy, I want to know what their magnesium level is, their B12 level, their vitamin D, has their thyroid been checked. Let's look at something else that we could treat that may be contributing to this. There are a few studies that maybe alpha lipoic acid, which is a supplement, could help. Most of those studies were done on patients with a history of diabetes. And then if the neuropathy gets so bad during chemotherapy, you'll find that your oncologist will have to decrease the dose or even stop chemotherapy. And that's something we want to try to prevent because you're going to have a better outcome if you get your full course of treatment. So those are some of the treatment options. And then, well, how long does this neuropathy last? For many, the symptoms just gradually improve, or disappear months to years after chemotherapy. In some cases, it can be persistent and may not ever fully resolve. And there's some patients who experience this, what's called coasting, where the symptoms may continue to worsen even for a period after treatment stopped. So it really varies. I think the earlier we get in there and treat it, the better chance we have of avoiding long-term complications. So that's kind of the burst of information I want to give you. But now I'd kind of like to stop sharing here and let's just open it up and hear from the real experts, which are you guys.